Hi everyone, welcome to week number 6. This week what we're dealing with is the syringe method, which is that final blood draw method that we have to work with. And we're also learning about the chapter of immunology, which is going to be chapter 7. So let's start off by talking about your syringe method, that final method that we have to learn. So we've learned vacuum, we've learned butterfly, now we're rounding it up with syringe. Now you'll find that the syringe method is very similar to what you've worked with in the past when we did injection, okay? So what I mean by that is you're going to have the exact same setup. So it's going to have that syringe with the barrel and the plunger, and you're going to have a needle that attaches at the top. That needle is called a hypodermic needle. Your syringe method is really used for people who have frail veins or they, collapse under the pressure of the vacuum cleaner method. Those vacuum tubes can cause too much pressure and make the patient's veins collapse. So when we do this method, the reason that we do it is because we want to be able to measure and control the amount of pressure that's exerted on those patients' veins. Okay? Your syringe sizes can range anywhere from 2 to 20 milliliters, and your needle size is anywhere from 20 to 22 gauge with 1 to 1.5 inches. Okay? The syringe method has the same order of draw as you'll find with the vacutainer or with butterfly method, so no real changes there. I think you guys have heard me say it enough, but I'm going to repeat it one more time because the order of draw is so important. So you're always going to start with your blood culture bottles, or those yellow top tubes. Then you're going to move to the light blue top tube, move to red, which is plain, has nothing in it, green, which has the sodium or lithium heparin, lavender, which has your EDTA, and the last one rounding it out is the gray top tubes, or those sodium fluoride. Alright, so that's kind of the big method there. Really no changes for the different vacutainer method or blood draw procedures, just having a different way of doing each of them, okay? So let's talk about the immunology chapter, which is going to be chapter 7. This is the one that I want you to read prior to coming to class, but I'm going to kind of touch on some of the big points of it. So when we start off by talking about that, what I'm talking about is your immunology deals with your immune system. And your immune system really is a defense mechanism that's put in place to help protect our bodies from foreign invaders, or things such as pathogens, toxins, cancer cells, anything that's not supposed to be in your body. Your immune system is there to protect us. Okay? When we talk about your immune system, there is one key component or one key piece that I really want you to know, and that's when dealing with antibodies. So antibodies are produced when a foreign body or an antigen comes into your body that's not supposed to be there. So anytime there's a foreign invader, your body will produce an antibody that's going to go in and try to remove that foreign substance. Okay? And antigens, when we talk about those are those foreign bodies that aren't supposed to be there. Again, those pathogens, cancer cells, toxins, allergens, anything that's not supposed to be in your body is considered an antigen. Okay? And once your antibodies are produced, they attack the antigens and try to destroy them or render them harmless. But sometimes your antibodies can't really do the whole job for you. So we've got something in our bodies called our immune process. And our immune process is really 3 levels of defense that are put in place to protect our body. When we talk about the 3 levels of defense, I'm going to give them some interesting names so that way you can hopefully remember them a little bit easier. So that first line of defense is when we talk about your skin and your mucous membranes, okay? And they're the first thing that any foreign substance will come in contact with. Those I want you to think of as the bouncers to a club, okay? If you're trying to get into a high-end club, a bouncer is going to stop you from coming in unless you have your name's on the red carpet list, let's call it. So bouncers are your first line of defense, and those are the skin and mucous membrane. Then your second layer of defense comes in if any antigens or foreign substances get past that line of defense, okay? So something still comes in after it gets through your mucous membranes and your skin. This is when the second layer comes in. And the second layer I want you to think of as your SWAT team, okay? Their whole purpose is to go in and ingest or eat the bad cells or pathogens that come in. And that's going to send out what are called phagocytosis. So that's why I want you to think of, or phagocytes, that's why I want you to think of them as your SWAT team. So we're going to send out the phagocytes once our bouncers haven't really kept anybody out. And that process is called phagocytosis. That's where those phagocytes will eat and destroy and consume those cells that got in past your skin and mucous membrane. Natural killer cells are a special type of lymphocyte that are sent to the scene to attack and destroy the body's infected cells and the cancer cells in non-specific ways. So what that means is you've got different types of cells that are going to go out and try to help at the scene of the crime as well, hence why I call them the SWAT team. And then if your bouncers and your SWAT team really haven't done their job, or maybe haven't done it completely, that's where your third line of defense comes in. And I want to call them the cleanup crew. Okay? Their job is, if the first two haven't done their job, they're going to come in and destroy everyone. Okay? They're going to bomb the place. Okay? And then they're going to clean up after it. So really what this consists of is your T and B cells, and they work together to produce a specific antibody that will destroy and attack the invader and render them harmless once and for all. Okay? So that third line of defense is like a bomb coming in. Okay? The whole immune process takes somewhere between 6 to 10 days. That's why infection stages take a little bit longer, because your immune system is trying to catch up and kill everyone that doesn't belong there. Okay? There are a couple of different types of immunity that a body can have. The first one I want to talk about is cell-mediated immunity. And this is really consisting of your T cells and the small lymphocytes that are associated with your thymus gland. Okay? T cells are going to duplicate quickly, cloning themselves, and they can differentiate themselves into 4 different categories. And the 4 different categories are killer cells, killer T cells, helper T cells, suppressor T cells, and memory T cells. I'm putting it on you guys to actually be able to tell me the difference between the 4 types, but I'm giving you the heads up, those are the 4, okay? And once your T cells hit action, they become active at the site of the invasion after they've received the antigen presentation from your macrophages. So after they get a newsletter saying, hey, this is what's happening, they're going to kick into place and actually come in to help do their job. The second type of immunity that we can have is humoral or antibody medicated. Okay? So this is where your B cells actually get involved. So cell-mediated deals with your T cells. Humoral deals with your B cells. And they're activated, and they can clone themselves into 2 groups, as opposed to T cells, which do 4 groups. They can only clone themselves into 2. Those are the plasma B cells and the memory B cells. So you'll notice that you can have memory T and memory B cells. So make sure that you understand the difference between all of the cell groups, okay? So an interaction between your B cells and a specific antigen form helper T cells, okay? So in a way, you need the B before you can have the T. That's a nice way to think about it. And think about it alphabetically. Before B comes before T. Alright, so that's kind of a brief overview of the immune system in itself. Let's talk about what we're going to do in lab this week. So this week in lab, we're actually running a mononucleosis test. This is a point-of-care test, or a POCT. It can be done in an office, so it's also CLIA waived. So when we talk about a mononucleosis test, what we're looking for is the causative agent, which is the Epstein-Barr virus, or EBV. It's also been known to be called the kissing disease because it's transmitted by direct contact with your saliva. And I want to talk about some clinical signs of mononucleosis. So what you can have, if you have a patient that comes in and they're complaining of these symptoms, the doctor may want to run a test for mono. And those signs are mental and physical fatigue, severe weakness, headaches, fever, sore throat, and swollen lymph nodes. Okay, could be a rare, chance that mono would come up. I haven't seen it very often in the field, but we want to be sure just in case that we know how to do this test. Okay. Some of the hematology findings would be an increase in your reactive lymphocytes, which is why we would draw an actual blood panel. But what we'll be doing is just a finger stick in class. Another hematology finding would be that your antibody that is produced during this infection, and that would show up as what was called a heterophilia antibody. So if that comes up back in blood work, then we know that there's a very good chance that you have the Epstein-Barr virus causing mononucleosis. Okay? Within 3 weeks of the infection of mononucleosis, 80% of its patients will have a detectable level of that specific antibody. Before then, they just have those clinical signs. Okay? So this week you'll have 2 finger stick pokes, one for the mono test and one for your blood glucose urinalysis log that we do every week. Please make sure that you read your chapters on your own. I know I do a brief overview, but I don't touch on everything. So I want to make sure that you guys are actually reading your chapters and understanding it as well. You will have 1 discussion post this week dealing with blood typing. So you'll see that there's a video posted below my video. And what that is it's dealing with your discussion post. You really need to watch that video prior to answering the discussion post because you really won't know how to answer it otherwise. Okay? And this week you have midterms. So we'll do a midterm review like we've done every quarter past and every class past. So we'll have a midterm review, and then your midterm will be due Sunday at midnight. And I think that's really all that I have for you guys this week. I look forward to seeing you on Thursday. Have a wonderful week. Bye, ladies.